Good morning. I just want to test the audio. So if someone can just do a thumbs up if you hear me, that'd be good. Amazing. Awesome. Awesome. Okay. So we are at 9, and I want to make sure we get through a quite large deck and then also have opportunities for Q&A. So I'll just start off. And then again, if you have any questions throughout the presentations, feel free to raise your hand and ask, or wait until the end. Either one of them work for me. Okay. I won't be looking at the chat, so please try not to put in the chat unless you want me to look at it after the presentation, and then absolutely I'll look at the chat if there's any comments or questions. Okay, so the intent of the call today is to discuss our MDSAP voices, sharing real-world experiences to shape the future. So I'll talk a little bit about the agenda in the next few slides, but I just wanted to share with you a little bit about myself. I know some of you are MedTech members and some of you are not, so I just want to make sure that you have a little bit of a background about myself. And I'm not going to read the whole thing, but I've been in industry for 25 years, and I've been at MedTech Canada since 2022 as a VP of Regulatory Quality and Environmental Affairs. I've worked in different types of industry, pharmaceutical, medical devices, cosmetics. I've also done some consulting, and as I mentioned, now I'm at MedTech Canada, which is a trade association. So a little bit about the agenda for today. I'll talk a little bit about MedTech Canada for those ones that are not aware of what MedTech Canada is. I'll talk a little bit about what's the intent of this presentation. Then I'll go a little bit about a background around the evolution of our quality system requirements for medical devices in Canada. A few key items around the MDSAP governance and key focus areas, and that's coming from MDSAP RAC themselves from their presentation this past year in Amsterdam. I'll talk a little bit about how in Canada we leverage our certificate and different kind of ways of bringing in product into the market. There's a few ways of using MDSAP and bringing your product into the market. And then I really focus on the main goal of this presentation is talk about um, historical, current, and future perspective of industry and how we provide voice of industry to Health Canada and into the MDSAP system. And also provide some information around our survey, which has now been updated, and also seek your questions and ultimately your hopefully participation in contributing to the survey questions and results. So a bit about MedTech Canada. So our mission is to foster a strong, dynamic medical technology sector for better healthcare for Canadians. And our vision is for Canada to become a leader in realizing benefits for medical technologies. And we advocate in different kind of ways, this being one of them, but obviously we also have other ways like a conference I'll talk about a bit later. And we also have meetings with Health Canada and other international bodies. And our members are comprised of different kind of industry throughout the medtech ecosystem in Canada, manufacturers, distributors, associations, consultants, and more. So why are we here today? Some of you might be wondering. So hopefully this answers your question. I want to talk a bit about the MDSAP program. There's a lot of information out there, but what I have found throughout my career is that some information is accurate and some of it is not. And so hopefully the outcome of this presentation is you hear something that gives you a little bit more accurate information, and also you have an opportunity to ask questions, and hopefully I give you accurate answers. We want to also talk about how industry can engage with our regulators and auditing organizations to provide constructive and data-driven feedback. We also want to seek your engagement in our survey. We're also going to use this recording as a training tool, and we're going to add it to the survey. And so future industry members that might have similar questions that haven't been able to join this webinar, they will be able to listen into the webinar, and hopefully it will give them the answers to the questions they may have and ultimately participate in the survey. We want to answer any questions you may have. And ultimately, the whole intent of this and all the work that we do at MedTech Canada is to increase industry's participation in the MDSAP program and obviously enhance the program and improve it. So a little bit about, and I'm going to go briefly over this just to get everybody on the same page, because I know that we all come to where we are today from different kind of pathways. We might have been from cosmetics or from pharmaceuticals, or maybe we haven't been here since the start of the quality systems in Canada. So it's important for us to understand the background in order for us to understand how we want to shape the future. So really briefly around the background. So 1975, 2003, we had direct inspection with Health Canada, and they developed the auditing organization. At the time, it was called the registrars, but now we've moved to AOs, which are auditing organizations. And in 2003, it was introduced in Canada, the ISO 1348 and 85. 88 was for class twos, and 85 was class threes and fours. In 2006, they then transitioned into the CAMDCAS system. Again, all throughout this time, since 2003, we were audited and continue to be audited by auditing organizations. The real difference was how we were being audited, what questions were asked during the audit. But in essence, it was the same process. We get audited, we get a certificate, we provide the certificate to Health Canada with our license application. And, if the device was in scope, then hopefully, and all our information was correct, we get the license. So that process hasn't changed. What has changed is what the quality system requirements are, how we're being audited, etc. And then in 2017, we transitioned from CAMDCAS to MDSAP, and the transition ended in 2019. The big difference there is that everything up to this point was really Canada focused, as in ISO 1348, 85, CAMDCAS, all of that. When you got the certificate, it was only good for Canada. And in 2017, 2019, when transitioned to MDSAP, what that enabled us to do is become more of an internet. The power of MDSAP is an international, and in that companies that have MDSAP, it is good for not only the 5 countries that are signatories or part of the RAC for MDSAP, but also it is recognized by other um, jurisdictions as well. So that was a big shift and a really big improvement at that time for MDSAP. And again, just a quick background and not into detail, but again, that MDSAP also had an evolution, right? So it started in 2012, the conversations, 2012 to 2014, there was a development, there was a pilot, and then Japan joined, there was proof of concept. So all of this was done in stages, and the whole intent was to pause, think, review, make sure that it was done in the right way to really provide the impact that was sought, right? So there was alignment, harmonization, and this was the original logo of MDSAP. And last year they changed the logo to this one, which think is quite pretty. But anyway, so that there's a lot of evolution there, as well as MDSAP website. Up to that point, they didn't have a home. It was really hosted by the FDA's website, but last year they actually created their own website. So if you Google it, I think it's mdsap.global, but you will find it easily, and they have great information in there. And you can sign up also to their RSS feed, and then you can get obviously notifications when they update their documents. So a lot of great information in that website. So this is the next piece is really from the MDSAP RAC, and it talks about things that they've been working on. And why is it important to us? Because, we are the auditees. We require the certificate in order to do our business, but we also need to get from them their feedback. How are they using it? What are their focus areas? Because it's a collaboration. And so, just a little bit of who manages or how is it governed. So there's the 5 countries, right? There's Brazil, Canada, Australia, US, and did I say Canada and Japan? And so they take turns in being the secretariat. So up to last year was Australia for 2 years. Now we US. And next will be Canada in 2028 and 2029. So there's always a transition. Um, it does not mean that where the years that the secretariat is in place, all the meetings take place in those countries. So, for example, the meeting for this year, which will happens once a year. This year it's happening in Japan. Last year it happened in Australia. So the location of the meetings are not reflective of the secretariat. There's a decision based on maximizing impact and communication. So that happens obviously at the secretariat level. We don't have a call on that, but just to let you know that it's not related. So hopefully when it comes to Canada, for example, in the next couple of years in US, hopefully there is an opportunity to meet in Canada or in the US, but not necessarily that's going to be the case. These are the areas that when TGA, which is Australia, took over, these are the areas that were delineated as areas where they want to focus and improve, or again, as I said, focus on. So they want to increase capacity, monitor performance, improve timelines, quality, rapid identification, escalation of resolutions of issues, report on performance, and increased engagement. Sounds great, right? And they actually achieved quite a few of these, and they had quite a few in progress. And again, I'm not going to go into detail, but the whole intent of this is to show that they recognize, like we all do, that everything that we put in place always needs to be looked at, reviewed, improved. Our laws need to do that. MDSAP needs to do that. So it's good to see that they're tackling areas and working on improving them. And I think the key part here is that this cannot be done in silos. So all of these items, all of these areas that they want to tackle, they collaborate or seek feedback from the auditing organizations and industry. And this is where it ties in later on into our survey. And this, by the way, is what they were still working on in 2025 and 2026. And I think now that the Secretariat from the US took over, I'm sure there's going to be some updates on this as well. Okay. And I will be sharing the recording with you afterwards as well, these slides. And there's a link here to the MDSAP outcome statement for 2025. So feel free again to take a look at that. Some numbers. Again, just the what I'm trying to convey here is that it is a successful program. There's a lot of companies that have this audit. There is 4,300 and change companies that have MDSAP certificate across the world. Obviously, an MDSAP certificate can have more than one facility. So you can see there's 7,300 and change facilities that participate in MDSAP, etc. So definitely, it's been increasing year over year, which is a great signal of a successful program. Another thing that was quite interesting, because I know people here, well, MDSAP is 5 countries, and yes, there's some affiliates, etc. But you can see here that this is where MDSAP certificates or MDSAP facilities actually are located, and you can see the distribution is everywhere. And obviously, we can see the rest of the world. US is the most broadly where most of the companies have MDSAP at this point, but it's not the majority of all MDSAP because you see there are 36%. So obviously there's another 64 or maybe 63.8 that are not in the US. But again, as you can see, there's China, Germany, Canada, etc. is where the manufacturing or any other MDSAP activities that take place that need to be covered in the certificate. So definitely it's been adopted through many countries. So I'm going to briefly talk now about leveraging the MDSAP certificate into Canadian market, and I won't go into too much detail. This is from another presentation that I had, which was a longer one. I was able to go into detail, but it's interesting to me that sometimes regulatory people and companies are not aware there's a few ways to use your MDSAP or to use someone else's MDSAP to bring your product into Canada. And so I just wanted to quickly touch base on this. And if you have questions, more detail around this, at the end, my last slide does have my contact information. So please feel free to reach out to me and say, Mia, can you just expand on those slides a bit? I'm more than happy to do so. But there's 2 ways to access getting licenses in Canada if you today don't have an MDSAP. One of them is to get an MDSAP, right? And I call it the one-step approach, okay? The other one is what we tend to call private labeling, is where you use someone else's MDSAP to get that license, and then you then do a private label license where in essence, what hits the market has your name on it, but the MDSAP holder is another company. And that relationship is also quite common. At the end of the day, if you have a medical device in Canada, class 2, 3, or 4, you will require somewhere along the line an MDSAP, and then you might, again, get your own, or use someone else's private label. There are benefits and drawbacks for both of them. And sometimes what I find is companies might start with one platform and then move to the other one based on business needs, market access, and all that kind of stuff. So it is fluid. You can flip from one to the other. But again, it's not a quick flip. And obviously, there needs to be a business rationale for that. So the one-step approach, the pro of that, and obviously that means you getting your own license, is it is a higher, from a business perspective, it is a higher profit margin because you are removing a middle company from the middle. Obviously, they're going to charge you. And so that's one part. There is less follow-up steps, meaning that because you own the quality system, you can make a lot of the decisions. You don't have to ask for approvals. You don't have to coordinate with another company. So that makes it faster. You are independent, meaning that if today you have a supplier into your quality system and tomorrow you want to change it, you own that, you can do that, versus if someone else owns the MDSAP, you have to rely on them and you have to ask them, and they may say, yes, I can, or no, I can't. And again, future line flexibility is as usually companies, when they start selling a product, they always want to complement it, or they want to add more product lines or more codes. And when you have your MDSAP, you can control that. You can, do whatever you want. It is your system. The con is that simply if you don't have an MDSAP and you want to get it, it just takes it a little bit long, your company a little bit longer to get the initial certification, and you'll have to have a larger initial investment. I mean, it's not much larger than if you have already an ISO 13485. So it also depends, the investment depends on where your starting point is. But again, there is an additional investment. If you want a multi-step approaches and you want to potentially use someone else's MDSAP and then your own, the positive or the pro on that is it's quicker to market because someone already has the MDSAP. So you just need to do a gap analysis and then see what needs to be done in order for them to include your product if it isn't already, and then them getting the license. And it's a lower initial investment. So I find usually SMEs or small, medium enterprises that have access to the Canadian market, and they have this product which they're not 100% sure, or maybe they think it's going to be slower to adopt into Canada, that they sometimes choose this one because it is a smaller initial investment, and also gives an opportunity to test the market before saying, okay, there is enough market here that I want to become independent. I want to get my own MDSAP. So some businesses, I found them doing this one. And that's the pro, a quicker to market, lower initial investment. And the con is, again, you will have an impact on your profit margin. There is additional steps, and you obviously are relying on another company, and it's a bit less flexible around future product lines because you always have to go back to the original MDSAP holder to see if your new product can fit into their MDSAP certificate. So I'll just leave it there. And the next few slides, I'm not going to go into them, but it just talks about some of the thoughts around, when you have your MDSAP, what can you do in parallel while you're getting your MDSAP? And again, don't quote me on these. These are just estimates, but how long I've seen things take. It could take shorter, it could take longer. It really depends on your starting point. And then the multi-step approach, this is where the private label terminology comes up. And again, I'll leave it like that. And again, if you want to get more feedback on this, I'm happy to do so on a one-to-one call. Okay, so in summary, there's various ways to approach obtaining a medical device license in Canada. The system is quite flexible, what is most important is that as you're planning to bring your product into market, make sure you have a good regulatory strategy that includes your business, because that will really play a big factor in how you want to approach MDSAP, either direct, one-step approach, or multi-step approach. Okay. So the next thing I want to talk a bit about historically, how has industry interacted with our regulators around these quality systems, the past, the present, and hopefully where we envision the future. So just as and I think this is kind of common in all jurisdictions or most jurisdictions. So industry's voice is an important cornerstone of a balancing and effective regulatory system. The way the government reaches out to us or us reach out to them, there's policies, there's regulations, there is partnership with stakeholders, There is industry representation, and this can happen in different ways, like public consultations, conferences, bilats, advisory committees, partnerships and collaboration, workshops, and surveys as well. So there's so many ways that we today, Canadians, collaborate and engage with the government, both federally and provincially. But in this particular topic, we obviously Food and Drug Act is federal, so we can focus on the federal. How is it beneficial? It aligns policy with ground reality. When a consultations comes out, and a recent one just came out and we closed off on that, and we provided as Medtech Canada feedback was around medical device establishment licenses, is that the government thinks about changes to the law or a new law, but they're not industry. It is always very important that industry provide our feedback into it to make sure that that law is something that improves and enhances and not creates additional challenges. And so that's where it's very important that our voice comes forward. So we align policies with ground reality, we foster innovation, we build public trust and transparency, encourage accountability, and we also ensure that there's a diverse stakeholder representation. So one of the things, if you saw back to our Medtech Canada's membership, we are very diverse. We're not just manufacturers, importers, distributors, consultants, and that provides a really diverse voice of industry to Health Canada when we want to provide feedback. So let's go back to the quality systems, and if you go back to the history, how it was in the beginning where Health Canada would audit us directly, and then let's see how evolution took place. So from 1998 to 2003, we communicated directly with Health Canada. Obviously, they would audit us. We communicate to them on different kind of things around the quality system. Then from 2003 2013, when they implemented ISO 1348588 and then CAMDCAS, the direct communication happened with the auditing organizations around the quality system and the audits, and indirectly with Health Canada. Obviously, whenever there is some question that the AOs and industry can't answer, we will reach out to Health Canada. But our main communication pathway was with the auditing organizations and indirectly with Health Canada. And you can see, and the example I'm trying to provide is like in the beginning was straight, it was clear, straight to Health Canada. 2003, 2013, the cars mean the AOs. So there's a little bit traffic on the highway, right? And when MDSAP was implemented, this is what happened. There was a lot of information being shared through various AOs, various regulatory bodies. And the reason I say that is because MDSAP right now includes 5 jurisdictions plus the other affiliates. So the highway became very busy, and information is flying everywhere. And some of this information is very important information that we want to really filter through, collect, and provide, right? Because if we go back to the other slide, information from industry is very crucial for enhancement and, again, of the program, of the regulations, of the guidelines. So in other words, if we look back to when it wasn't MDSAP, industry would talk to Health Canada would talk to industry. Sometimes there's an industry association such as us, and then we would talk to the industry, and we would also talk to Health Canada. There is set forms of providing the feedback through, right? It's not kind of like emails flying everywhere. There is consultations, there's conference. Again, that's kind of very structured. So that's prior to MDSAP. When MDSAP came about, we also had a new stakeholder, the auditing organization. So now industry was talking to auditing organization. They were also talking to Health Canada. Health Canada was talking to the auditing organization. We have the industry trade associations. They were talking to industry. They were talking to Health Canada. So it became a bit more complicated because you can see all these streams of communication. But in this case, once this came about, there was no structure of communication like consultations and like conference. There wasn't anything structured. That's where the emails start coming, ad hoc conversations. So that's where this started kind of a little bit becoming a bit messy, that big highway with a lot of information. Now, technically, and this is a real life example of an international company that has an MDSAP, and that company has the 5 jurisdictions on their MDSAP. These are all the lines of communication that could and do sometimes occur today. So I'll let it play and you can see how much information is flying through the different stakeholders. So again, there's one company, one AO. They might be part of the 5 industry associations, and there's the 5 jurisdictions. This is a lot of information. And the question is, what is the mechanism to capture this real world data that can really be provided in a clean way in order to identify areas of enhancements, areas of celebration because we've improved on things? How can we do that today? And today, based on industry's understanding, that has not existed other than the survey that I'll talk about a little bit later. So this is the present state. We're working to create a clean and simple pathway to communicate for communication. Now, there's different ways that we're working on. The survey is just one of them. We're also working, there is an MDSAP forum. It happens every year, as I mentioned before. The next one will be in Japan in June. There is in that forum, there is opportunity for all stakeholders to collaborate and speak. And then there is the closed sessions, which is just for jurisdictions and auditing organizations, but that's another opportunity to collaborate and communicate. There's also obviously always indirect engagement through our jurisdiction. So for example, MedTech Canada has once a year bilats with Health Canada. And in the recent one, which happened in November 2025, one of the topics was MDSAP. Now, this is very important as well because although MDSAP covers the 5 jurisdictions and there's a lot of common themes, there's also some unique themes that are really related just to specific countries and their laws. And so in our meeting in our bilat in November, we spoke to Health Canada on some areas where were common themes that are really more like based on ISO 1345. And we also spoke about some themes that were really specific to the Canadian regulations and areas where we sought additional feedback or changes. So that direct communication with the regulator is always very important and should not be kind of put to the side when it goes to the RAC, the MDSAP RAC, because there is always nuance, country specific nuances that we want to make sure we continue collaborating on. And as I said, there's also ad hoc engagements. So in other words, and we'll talk a little bit about the survey, one of the things that we did a couple of years ago, and I won't go into too much detail, other to say that we wanted to do a proof of concept and that this survey worked. Now, people say sometimes we're surveyed out. There's so many surveys out there. I think one of the things, though, the question is there another way to capture real world data in a way that can be used? And yes, you can have a conference, you can have a conversation, but it's hard to capture data in a way that can be used to really see improvements or provide feedback. And so we, in 2024, we collaborated with another association called MTAA, and we sent out a survey. It was a bit of a long survey, but that was one of the things we wanted to make sure is that our members, is industry interested in answering these questions? And the overwhelming response was yes. The other thing is we found a lot of great data from that survey. For example, 69 of the respondents indicated that they use MDSAP fully, as in they had MDSAP for all 5 countries, which is exactly what we want to see, because the more you use that MDSAP, the more the whole idea about MDSAP is that you have alignment across jurisdictions, which is something we always want as industry. So when you get something for one country, it's used for other ones as well, so you don't duplicate. So 69% of the respondents said they use MDSAP for all 5 countries. Amazing. And only 4% had MDSAP for one country. And you would think that it would be Canada for all of them because obviously Canada is the only one that requires MDSAP. But interestingly enough, there was also some companies that had MDSAP only for the United States. So again, there was really good information around that, something that we had not been aware of before. Some of the things also we wanted to capture is that there's companies coming into MDSAP with an expectation of benefit, but also we wanted to understand after they had MDSAP, what was the benefit that they found? And really what we saw is that definitely companies came in with a certain expectation of benefit, but the outcome was much broader. There was much more benefits to MDSAP than originally thought of, right? And so that's really the messaging around this is that MDSAP is beneficial. There are benefits to it. And the more countries that engage in it, the more companies that engage in it, the bigger the benefit. So that's again was real world data that we were able to achieve through this survey. The other thing that we asked, and again, we asked for challenges, opportunities for improvement, and enhancements. So one of the areas that industry indicated was that they would like to see enhancements on the reports. Now, interestingly enough, when we presented this data, I think it was in 2024, the regulators also presented their areas of focus and they also indicated that they would like the reports to be improved. And so it was really interesting time where again it just shows that we are aligned in many areas and that we both wanted to see improvement on the reports. But what they want to see improved on the reports is probably different than what we want to see improved on the reports. So it's always very important that we align on these things to make sure that as the reports are being improved, that it also benefits both stakeholders, the regulators, as well as industry. But it was very interesting to see that we actually have similar areas where we wanted to see enhancement, both the regulators and the industry members. The other area was around auditor knowledge, another area of enhancement that we thought would be beneficial. But there's two areas that we think that auditors should are best to enhance their knowledge, and one of them is regulatory knowledge, and the other one is industry knowledge. And obviously, the regulators cannot help with industry knowledge. That's where industry comes about. Now, when we talk about regulators' knowledge, one of the signals that came up around this enhancement is that when a jurisdiction, and imagine there's five, when a jurisdiction comes up with a new law, and happens all the time, there is a gap between when the law gets enacted and the next audit of a company that needs to show proof that they enacted that regulation. And in between that time, there seems to be a need to enhance the speed at which the auditor is trained, because sometimes what would happen is that the auditor would come to audit right after a law got enacted and they weren't ready yet. They hadn't received the full, well, industry considered the full training to be able to audit against that new regulatory requirement. So that is one of the areas where, again, we provided feedback, and this was really positively received. And I do know that they have taken our feedback and looking at ways to enhance and improve on the training. So again, this is where this survey really helps enhance the program by providing them real world data around areas where we want to see additional improvements. Other areas that I'm just going to touch base on really quickly. The two first ones are, as I mentioned, the Canadian specific areas that we talked about with Health Canada last year. So in Canada, when you submit a license application, you actually also have to submit your certificate with the scope. And the scope is the list of, not list, but the scope of medical devices that are included part of the audit. And what we found sometimes was that when Health Canada would receive their license application and the scope, they could not see within that scope the product that we're applying for a license for. So it wasn't very clearly stated. And that caused a challenge because then they would reject it. They say that the MDSAP scope didn't include the device. Meanwhile, we know it did because obviously we were audited against it. And this has to do with simply updating the guidances and aligning between the auditing organization, industry, and Health Canada around what is a good scope. So there is a guidance on the not Health Canada, on the MDSAP global website. There is a guidance around certificates, and there is a little bit of a description around the scope, but we feel as industry that it should be expanded on to really help better guide AOs and industry around what would Health Canada consider a good scope. And the reason I mentioned Health Canada and not the other jurisdictions is because it seems to be a really Health Canada specific issue. The solution could be that either the MDSAP guidance gets updated or Health Canada creates their own guidance. Either one of them, we are working actively with Health Canada to resolve this. The other one also is a Canadian only issue, is where the MDSAP guidances talk about the certificate having an effectiveness date, while our laws say issue date. So really it's a technicality where our law doesn't align with the MDSAP guidances. And so we've reached out to Health Canada asking them to update the regulations to change the word from issue date to effectiveness date. You might think it's a really minor thing, but in fact, it does cause us challenges every time not every time, but when we update our certificates, our members have indicated it causes a little bit of a challenge for them because obviously the certificate says effective date and the law says issue date. So and the other things that we're working on, and this one is not only Canada specific, was around audit costs and audit length, something that's near and dear to our members and non-members to industry, in that there is this SME, a small and medium enterprise audit time reduction consideration for low risk, and there's some other qualifiers. It's already in the MDSAP guidance. However, industry has felt that it is not very clear when a company could qualify for it. How do they know that they qualified for it? What was the time reduction? And so we've been really bringing forward that particular item to Health Canada, and obviously they in turn to the RAC and to the AOs around getting better clarity for industry around this particular one. And it's very near and dear to us because there's a lot of innovators, et cetera, that we really want to see them succeed and get MDSAP. And as we hear, obviously when you're an innovator, money is very tight, and we do definitely want to make sure that they get any and all savings that apply to them in a clear, transparent way. So that's something that you'll also see some questions in our survey that we added it because we really want to understand from industry. Are you receiving your audit reduction days? And if not, why? Because we're really trying to understand this and then provide this guidance to Health Canada and therefore to the RAC around improving the guidance document in this area as well. And audit length is another one that we've got some feedback on, in that sometimes our members indicated that different auditing organizations are giving in different audit lengths for the same scope. And so really trying to understand why is that the case, and can we again enhance the program and improve on it so that we see more consistency across the different auditing organizations. That's some kind of areas that we're working on. So the current communication structure for MedTech Canada is we would reach out to Health Canada and to the auditing organizations. Now, when I say the AOs, it is those ones that participate with us. So we do have active engagement with some, but obviously not all 15. And in turn, obviously the AOs will reach out back to us, and Health Canada, if they think it's applicable, they reach out to the MDSAP RAC, which RAC is the 5 jurisdictions, and come back to us. So that's kind of what's happening right now around the current survey communication structure. And as you can see, if you go back to the picture that I had a few slides back where there's like all these intersecting highways, this is more clear. I mean, it's busy, and we don't expect it not to be busy. We want MDSAP to be busy, but we also want it to be very clear, straight to the point, transparent, and we know what we're doing, and there's no ambiguity. So, what we're trying to do right now is data-driven voice of industry through broad industry surveys, and obviously increase collaboration with industry associations, misspelled associations, auditing organizations, and obviously our regulators. And so the vision of the future really is industry reaching out to all 3 stakeholders, even industry speaking to industry. Improving how we engage with industry is very important as well to get the feedback. As I said, the benefit only shows if we reach out to as many industry as possible, applicable industry, right? So manufacturers, also importers and distributors are sometimes supporting MDSAP. So really getting all the feedback that we can in order to drive change, positive change. And in turn, we would like to get obviously feedback from them. So there's a few mechanisms that we're working on right now. Obviously, the Canadian survey is a starting point. There's also a plan, and I haven't heard yet what's the next step, but there's a plan to create an industry group within MDSAP, the global one, where we have representation of the different countries to, again, provide more direct information. But again, I can't speak too much of that because we haven't heard much other than there's a plan for it. But obviously, once it gets decided, it'll be published probably on the MDSAP website. So, spoke a lot. I'm going to have a one sip of coffee and then I'll talk now about our survey. So this is the QR code for the survey as well as the link, and I'll share again, as I said with you, the slides. One thing that's important is that it is not based on where you're located. It's based on, in this case, because it's a Canadian MedTech Canada survey, is that if your MDSAP includes Canada, we would really like for you to answer the survey. If it doesn't, if you choose to answer, please feel free to do so. But really, the focus is MedTech Canada because Canadian companies that, sorry, not Canadian, companies that have MDSAP for Canada and potentially other jurisdictions, because obviously I'm med to Canada. Now, interestingly enough, looking at the data, a majority of the current 4,300 and change certificate holders do have Canada within their scope. If we look back at the survey from a couple years ago, so we're really hoping to get a lot of feedback to really enhance the program. A few logistics around the survey. It is auto saving. So as you click next, as long as you use your same computer, if you want to leave it and come back to it, it will take you back to where you stopped. So that's really important because the survey is not short. It's not a 5-minute one. It can take 20 to 40 minutes. It is very comprehensive. And the reason for that is because it is anonymous. And I highlighted anonymous there and explain why. So, we have found that in order to get feedback or accurate real world data from industry, they felt and you felt more comfortable if it was anonymous. It makes sense for various reasons. Having said that, then because it is anonymous, we can't go back to you and say, what did you mean? Or was it in scope? Or da 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 da. We don't have that opportunity. And so, in order to make sure that we're able to make all of those assessments after the fact, bearing in mind that it is anonymous, we have to ask a few more questions. So as you go through the survey, and I hope you do, and you start answering, if some of these are like, why are they asking me this question? This is exactly why, because we want to make sure that it's comprehensive, you can really pull the data. And because it's anonymous, we cannot go back to you and ask additional questions. Now, I highlighted anonymous. Why? This year we added at the end, and I'll show you afterwards, we added at the end an option for you to receive feedback from us around the outcomes of the survey. Now, you can choose to remain anonymous, and therefore, and we gave an email address. You can contact us and say, hey, I answered the survey. And so we won't know which answer was yours, but answer the survey. I would really like to get feedback on the outcomes, and we can send it to you. If, however, you choose to not be anonymous, because say, listen, I have nothing to hide. This is our feedback, whatever. Here's my email address. That's good too. Okay. Or some of you might say, you know what? I provided my feedback. I'm not interested in updates, and it's just for you to use as you see fit. That's okay too. So we gave these 3 options. Okay. What will we do with the data? We'll create a comprehensive data-driven dashboard. We'll track and trend the signal. So one of the things that's important to know about this is that this is not a one-time only. The ask we have is that after you get audited by your AO, please respond to the survey, because we want to trend over time opportunities for enhancement, wins as well. If we see reductions in certain challenges, that would be wonderful. That's exactly what we want to do. We will also communicate with Health Canada trends and any signals, and again, positive trends, challenges, and whatnot. And we want to also support the collaborative and continuous improvement of the voice of industry to continue and improve the program and enhance adoption. Okay. Again, so I kind of spoke about this already. Now, there's a few survey sections to it, and in the cover page, and when you click on the link, this is there already, so it kind of explains it. I'm not going to go into various details on this, but what I wanted to point out is that many, if not most of the points in the survey are those ones that the MDSAP RAC indicated they wanted to look into and enhance and improve. This is their words. And so, as I mentioned in the beginning, we would like to provide accurate and real world data into their areas of enhancement. And this is a really good way of doing it because, again, it's data driven. A few Q&As that we've had in the past, and I wanted to walk through these. And again, obviously, if you have any questions, feel free to raise your hand and ask. But when should I complete the survey? We request that you complete the survey annually after your company undergoes an MDSAP audit. Now, if it's an MDSAP audit that results in a new certificate or an updated certificate, please wait until after you get the certificate, because there's some questions around timelines of receiving the certificate. If your audit is a surveillance one, or one that does not have a certificate, as soon as you get the report or whatnot, please complete the survey. Who's responsible? So some companies have only one site, and some companies have various sites. We only want one response per MDSAP certificate. So the best way for us to kind of make sure that there's only one is that the management representative, because there's only one per certificate. So that will be ideal, because then they know that they're not duplicating the answers. How should I go about completing the survey? Now, if you are the one that is going to start answering the survey, you might find questions in there that you don't have the answers for. And that's why it was important for us to make it in a way that you can save it, go ask questions, and come back. Alternatively, what you can do is get in a room together, the people that have participated or helped with the audit, and then all of you can answer it jointly. And that should be an easy exercise. You don't have to do, it can be a virtual room, doesn't have to be a physical room, especially if some of you are in different countries. So that's another idea of how to complete the survey. And how long will it take for me to complete the survey? So the survey is reactive. Depending on your answer, it will in some cases ask you different questions, because we want to make sure that it is we don't ask you questions that that have nothing to do with your experience. So it could take as little as 20 minutes, how much as 40 minutes. It really depends on what your experience has been in the last audit. And as I mentioned before, and I covered this because I want you to answer the survey to get the results, but you can remain anonymous by not clicking on this. The moment you click on this and give your email, we know who answered, right? So unless your email is a Gmail, then obviously we wouldn't know what company, but so you have a few options, and we do want you to receive the outcome of the survey results. We found it's very important for industry to learn about industry, to learn about the program. So in conclusion, and then I'll briefly show you the actual survey, is since its launch, the MDSAP has significantly reshaped the regulatory environment. They've had over 31,000 audits in 82 countries, and there's over 7,300 active facilities. Our success, or the program's success, relies on collaboration between industry, AOs, and regulators. And definitely in Canada, it's so critical to us because MDSAP in Canada is mandatory. We want to see the program enhance, improve, more participation from industry, more participation from jurisdictions and AOs. And this can only happen through open, honest, transparent, data sharing collaboration among the stakeholders, which is kind of what we're trying to achieve in a little piece through the survey. We are committing to advancing this program, and the future depends on, as I said, active engagement. Okay. Now, before I go and show you the survey, I want to also talk about our conference. So we have a conference in April 23rd and 24th. It is hybrid, so it's going to be in Ottawa in person, but it's hybrid. And most of the speakers are Health Canada. It could be either pre-market, post-market. And also we've reached out to Environment Canada because our healthcare products in Canada are regulated also by Environment Canada and some new rules this year. So long story short, that's when it's going to happen. We tend to have, and I do believe we're going to have this year as well, a session around MDSAP. And in the past, and we're working on it this year as well, it's going to be three stakeholders, as I mentioned. It's going to be Health Canada, an AO, which I believe at this point is going to be BSI, but I have to double check, and industry representation to speak about the MDSAP program. And again, continue this conversation of collaboration and how can we improve it, et cetera, and any new developments. So that's our conference in April. Again, if you have any questions, please let me know. In the beginning of the slide, also there's a website for our company, and under events, you can find also a link to the registration page. Okay. This is my contact information should you reach out to me with any additional questions. And I'm just going to stop. Let me see if I can stop sharing these slides. Are you guys still seeing my slide, or I stopped sharing?
We can still see it.
You can still see it. Okay, let's see how I can stop sharing it because it's still asking me to share. Okay, let me just. Okay, now you can see my screen, right? Okay. And what I want to do is I'm going to show you my, okay, so this is the link to, you can see my survey now, right? Yes?
Yes.
Okay, cool.
Yes.
Okay, so this is the link to the survey. As I said, there's a lot of good information in here. What I will be adding also is a link to this recording here. So as I said, future people, future industry members that want to understand more can go in here and get a little bit of this recording. But this is how it starts. And again, you click next, and then it asks you questions, et cetera, et cetera. Now, most importantly, anything with a star is mandatory. And the other thing is, in order to save your screen, your page, or your location, you have to click next. Once you click next and it takes you to the next page, whatever you did before has been saved. So that's a very, very important key item. And the last part I want to mention again is that, again, you have this, the question around how you want to receive the response or feedback on the survey. You know, this is the background. You don't see this part. This is my background on building the survey, but that's kind of, I wanted to show you again where we do want to understand from you how you want to receive back the data. Because for us, it's very important that as you provide data, obviously many of you, if not most, want to say, well, here I provided you very important information for my company. I would really like to get back the outcome of the survey. And we are working right now to identify how we want to provide this outcome, because we obviously want to make it in a way that is comprehensive, that is, there's no ambiguity, and that it makes sense to the receiver. So we're still working on that. But again, it has to start somewhere, and that somewhere has to start with receiving information so we can then provide that back. So that's all my slides at this point. I didn't want to see if any of you had any questions, want to raise your hand. Happy to provide any information. Yes, Hassan.
Hi, Mia. Thank you. Great presentation. One question, I noticed you indicated 69% of responders, they said they already have in all 5 jurisdictions.
Correct.
Again, wearing my SME hat, and I know that it requires additional resources and funding. So that indicates the kind of MedTech Canada membership profile that is maybe larger international or global corporation that they manage to maintain all 5 jurisdictions, and they probably have a product in them. Is that kind of true?
Well, the survey that was sent out to members and non-members, and because it's anonymous, I can't say who answered. And also that particular survey was kind of not published, but kind of was promoted by both MedTech Canada and MTAA now, which is the Australian Trade Association. Now, we do have a lot of members in common, but we also have some that are not in common. So I can't speak to that. I will say that, yes, I mean, the logic would be to think that these are large companies. I did not do that assessment, but I can actually look back, because one of our questions was around how many jurisdictions you cover on your MDSAP and how many employees do you have. And I actually go back and do that assessment to see if that's the case or not. It may or may not be the case. It really depends, right? It depends because adding other jurisdictions to your MDSAP depending on your product, could be a big effort and can be not a big effort, depending on what your product is. So it's a good tool to assess. And as we're working on creating those assessment tools, to your point, this is a curiosity that industry wants to understand, right? And so
Yes.
absolutely, that's some of the areas that when we're building the tool to kind of analyze the data, those are the we'll reach out to members, and our members say, what kind of data would you like to pull from this? And in the future also, we can change the survey questions based on industry feedback around what you want to learn from industry, right? So this is another one, right? So if we didn't have that question, I would have told you, Sasan, this is a great question. How about in the future survey, we'll add the question around, are you an SME? I will add one more thing on that. The terminology of SME is different from country to country and from what MDSAP considered an SME as well. And so it's very, very important when we're talking about SME and MDSAP, they have a guidance online that says, what do they consider MDSAP, SME? So that's another one. It's a great question.
Thank you.
Yeah, thank you. Tanima, go ahead.
First, Happy New Year to you.
Happy New Year to you
Lots
too.
of prosperity and health to you. So I had a question. So we had our MDSAP audit. We got our certificate in Q4, and then we immediately added that to our Health Canada license. So we got our Health Canada license, and now we're going to Australia. Question I had was mutual recognition agreements. So, once you've got your MDSAP cert, we'd like to be able to leverage that cert and use it for other jurisdictions beyond the 5. My understanding is TGA and MHRA in the UK have got mutual recognition agreements. So if I get myself cleared with Australia, I can get myself cleared with UK by using these mutual recognition agreements. Is there a way for you to share with us, how do we go from that core set of 5 countries and beyond with the MRAs?
With the MRA. So there's two things here. When you're licensing your product, there's actually 2 different approvals that need to happen. There is the facility, which is what MDSAP is, and it's the product, which is, I think, what you're speaking to. I think that although we would like to see a country have both, I think these are 2 different pathways. So in regards to the MDSAP, in the MDSAP forum, there is the 5 jurisdictions. There's also affiliates. I don't have if you go on the website, you can see who's in the pipeline. I think one of the things that we can do as industry is go to our jurisdiction and explain to them how beneficial MDSAP is to mutual recognitions from a facility audit. And really it's for industry to also really push that narrative. So I think the more we do that, the more jurisdictions understand that it's beneficial for us, the more they'll be open to that. So I think we have something to do with regards to enhancing that. And even in the MDSAP forum, we can also bring this up around, and we're doing that already. I think we're trying to engage, or we've not trying to, Europe has been engaged already and tried to getting them on board for MDSAP. So that's what we can do. From a product licensing perspective, that's where there is IMDRF, and that's where they play a factor. There is 2 industry associations, GMTA and DITA, and I see some of you are probably part of those. And that's the venue where industry can engage and push that narrative. And that's happening today, by the way. That continues and happening. So I think that there's 2 ways of doing that. And we can move it there. I cannot speak for other countries, but in Canada, not necessarily the government body that is responsible for MDSAP is also responsible for product approvals. It's 2 different directorates or 2 different policies. So I think that is also complexity that needs to be assessed jurisdiction by jurisdictions, because sometimes what industry ends up doing is we need to actually introduce one to the other to say, we have a joint suggestion and proposition. So I think, if I can say this, I think industry has a lot to say in this. And I think industry getting together, you don't have to do it through your trade association, but it does help because you already have other members there, engaging your jurisdictions and providing them this feedback. I think that's where we need to go. I mean, Australia didn't wake up one day and said, how about blah, blah, blah. Obviously, industry reached out to them to say, we need this, we want this. So I think that's our piece to play in all of this.
Okay, thank you. Great presentation.
Thank you. Thank you. Anybody else have any questions? Okay, well, thank you so much for your time. I really appreciate it. I will send you the recording hopefully within the week and the slides and the link to the survey. And please, if you found this useful, share it with your other industry members. And we really look forward to getting some great data and sharing it back with you and with our regulator and really enhancing the program moving forward. So thank you so much for your time. Have a great Thursday. Okay, and have a great rest of the day. Thank you.
Thank you.